This conference will now be recorded.
Okay, I think we're still waiting for Dr. Tedros. We have about less than a minute, but hopefully he'll be walking in soon. My name is Mtunzi, for those who are already connected, and welcome to the IOE Digital Conference on Back to Work Policies. I see Ashraf from South Africa. There's a lot of people here. Jorge from Venezuela. Welcome, Jorge. So I think whilst we are waiting for Dr. Tedros, colleagues, a number of us have been on these video calls. That's all we've done in the last few weeks. But just to deal with some basic kind of housekeeping issues so that we do not inadvertently embarrass ourselves. If you're not on, try and mute your microphone. It helps a lot because you're never aware what might happen behind you when you're not looking, and then we can all hear. Whilst we all need some entertainment in this very crisis-ridden period, I think that's not the kind of entertainment we're looking for, right? I think also if we could, just by way of advice, that should you find that you've got connection problems, do turn off your camera. It normally helps and lessens the weight on the bandwidth. Dr. Tedros has just come in, so I'll just wait for him to settle so that I'm certain that he's with us. Hey, Johnny. Hello, Johnny. Johnny from ILO Pretoria. ILO Pretoria. Hello. Ton, one of our members.
Okay. I'm Tunzi.
Can I ask a question?
Yes, Jacques, you can ask a question. I think that will help.
Yeah, well, it's pretty simple. So, when there's slides, are they projected here below us so that we can see them ourselves?
The slides are on there. My team will get reduced.
Oh, yeah, okay.
There's the slide. So can you see that slide right now?
Yeah, absolutely. Good.
Okay.
Thank you.
Okay. Thank you. I think, colleagues, Dr. Tedros seems to be ready now. I'm going to start so that we don't run late. I know we all have very tight schedules, and we all have to run back and make sure that things are running so that we have business continuity. I just want to repeat, please do pay attention to your microphones. When you're not on, do try and mute your microphone so that we don't have any inadvertent slip-ups that happen. If your connection is not a very good connection, do ensure that you switch off your camera. It always helps. Colleagues, most of you would have seen that we've got a few panelists. And I want to kick off with our president to welcome everybody first, Mr. Errol Keresepi. Then I'll come back with a few comments as we proceed into the agenda. Errol, over to you.
Thank you, Mtunzi. Hello, good afternoon, good morning, or good evening, where you are. I am very pleased to see all of you again, joining us virtually from different parts of the world. It has been a challenging few months to say the least, for all of us. I take this opportunity as president of the ILO family and global business community to pay tribute and appreciation to all healthcare workers who have been unrelenting on the front line in carrying out their risky duties. It is clear that the pandemic not only impacts lives, but also livelihoods. Various stakeholders at the global and national level are trying to coordinate efforts to contain the spread of the virus, mitigate risks, and actively move for a smooth recovery phase. As countries begin to ease restrictions in the coming weeks, employers of all sizes and from all sectors will be looking for guidance and expert advice on how to implement safe and effective back-to-work policies. Policies will aim at mitigating risks for all staff and prevent further possible spread of COVID-19, and at the same time offer a strategy to restore the economy in a responsible manner. This is why we have organized various digital conferences since the outbreak, so that we can have a platform to share best practices and lessons learned. And today, I am honored to welcome both the Director Generals of WHO and ILO, I will say the busiest UN agencies at the moment, as the virus affects health and jobs, the two essential things we need in life among many. The IOE is part of the WHO Business Response Platform. We hope to continue to complement each other's work, and we stand ready to be engaged with WHO on the global fight against this virus. It is important for all of us to stay engaged, learn from each other, and collaborate for a faster health and economic recovery. I am also privileged to have with us ITUC and industry leaders, SHRM and Randstad, who are here to share their perspectives and guidance on safe and effective back-to-work policies. The SHRM IOE Guide on Return to Work, which we will officially launch today, will provide members and company partners guidance on how to back to work safely. Thank you very much to all. Back to you, Batunzi.
Thank you, Errol. Thank you, Mr. President. Appreciate the welcome remarks. We move straight into the agenda, colleagues. All of you have seen that this is on back to work policies. Of course, you know, colleagues, we're laughing at this, that for the majority of us, it's not really back to work. We've been at work all along. We've all been working remotely. We continue to do so ever since this crisis started. But we do know what's happening all over the world. We've got colleagues in different countries who are at different stages of whether to go back now or what is the situation. So I want to introduce our very distinguished and honored guests, Dr. Tedros Adhanom Ghebreyesus, Director-General of the World Health Organization, Mr. Guy Ryder, Director-General of the ILO, Mr. Johnny C. Taylor Jr., President and CEO of the SHRM, and he had to wake up very early this morning. Thank you, Johnny, because where you are, I think it's like 7 in the morning. Mr. Jacques van den Broek, CEO of Randstad, and Ms. Sharan Burrow, General Secretary for ITUC. We are aware of your very tight agendas, colleagues, so we really appreciate your efforts to dedicate some time to join the business community in our efforts for a joint and coordinated session and action to face the return to work phase in the most appropriate manner. As countries, as I've said already, begin to ease restrictions in the coming weeks and months, employers from all sectors and of all sizes will be looking for guidance and expert advice on how to implement safe and effective back to work policies. Therefore, your expert insights in this respect are of the utmost importance. We're going to split the conference in 3 parts. First, we will listen to the interventions of Dr. Tedros and Mr. Guy Ryder, followed by a set of questions. I think I do need to just mention to you that we've done it like this, as you hopefully can understand, to ensure that should Dr. Tedros and Guy want to run, they can run, because they've got very pressing matters as well to deal with of a global nature. But of course, both of you are very welcome to stay for as long as you would like. We would like for you to stay, actually, but we do understand if you have to go. So we've structured in such a way that you can then be freed as soon as you need to. So after your session, we'll then go straight into your questions and then go into the next panel, which will then be followed by questions and so on. Without further delay, let me pass to our first speaker, Dr. Tedros. Dr. Tedros, the World Health Organization is at the forefront of the COVID fight. Everyone's seen more of you than they've ever seen before. Everyone has seen a lot of your colleagues than we've ever seen before. Your leadership and guidance have been crucial during this difficult time. I take this opportunity to express our deepest gratitude on behalf of the IOE and our business community. A lot of countries are relaxing lockdowns and implementing back-to-work strategies, yet the lasting effects of COVID-19 remain uncertain. And also, as we move forward, we need to hear some words of wisdom on how do we work together to prevent a resurgence of the virus, because there is this very real fear that there would be a resurgence as well. How do we mitigate this global risk in the back-to-work phase? These are some of the questions we are confronted with, Dr. Tedros. And when stepping into a new phase of the handling of the pandemic, what can you share with us in terms of insights on the various aspects? So we have about 10 minutes for everybody, and we'll have the necessary flexibility, but I do want to make sure we finish on time. So I will be on the strict side, and hand now over to you, Dr. Tedros.
Thank you, Vice President Mutunzi Mdwaba and our moderator, and also greetings to the President, Errol Kirosopi, and my brother, Guy Ryder, esteemed colleagues, ladies and gentlemen. Thank you for the invitation to speak to you today. In the weeks and months since January 30, when WHO declared a global health emergency over COVID, the virus has taken a heavy toll on the physical and mental health of millions of people. Hundreds of thousands of people have lost their lives, while societies, businesses, and whole economies have been badly disrupted. Now, as we're seeing hopeful signs in some countries that the number of new cases is declining, some governments are beginning to ease restrictions on physical distancing. WHO wants to see people returning to work and economies reopening as much as you do. But we cannot let down our guard. We still have a long way to go. Let me be clear. This is not the time to relax. More than ever, we must be deliberate in our actions, watching the impact of our every step. Remember that physical distancing only slows down transmission. It does not stop it. If we move too quickly to reduce physical distancing restrictions, we risk a resurgence that could be worse than what we have already experienced. WHO is providing the critical strategies, solutions, and supplies that countries will need in the coming weeks and months. We're working hard with an international consortium of scientists, companies, and countries to develop a vaccine, but that's not going to happen quickly. Until then, the only way to stop transmission is through implementing basic public health measures. That means case finding, testing, isolating, and caring for every case. Easing physical distancing restrictions must be done carefully in a planned and phased manner. Every country should be implementing a comprehensive set of measures to slow down transmission and save lives, with the aim of reaching a steady state of low level or no transmission. We ask you to work closely with national and local public health authorities so that the steps you take when it's time to lift restrictions do not put lives at risk. WHO will soon issue interim guidance for prevention and mitigation of COVID-19 in the workplace. You should refer to that document for in-depth information. I will briefly discuss some of the key guidance. Employers and managers, in consultation with workers, should carry out and regularly update the risk assessment for work-related exposure to COVID-19. It's preferable this is done with the support of occupational health services. Preventive measures, including decisions for opening, closing, and level of staffing, should be undertaken based on the workplace risk assessment and the compliance of workers and customers with these measures. Some of the issues to consider include hand hygiene, respiratory hygiene, physical distancing in common areas and during meetings, reducing travel, and regular environmental disinfection. Risk communication, training, and education for staff and managers are essential. Employees with symptoms of COVID-19 and their contacts should stay home, self-isolate, and contact local health authorities for testing and treatment guidance. Special measures are needed to protect those at higher risk of developing severe disease, such as older age and underlying medical conditions. These protections must apply to everybody, even if they're not direct employees, including workers in the informal and digital economy, those in small enterprises, domestic and migrant workers. In sum, if a return to work is rushed and is not done in a phased and cautious manner, it puts lives at risk and threatens to undermine our efforts to restore social and economic activity. Thank you all for your commitment to keeping your employees safe. WHO remains committed to providing you with evidence-based advice to help you make decisions that will get your businesses up and running as quickly as possible and as safely as possible. But for this to happen, one reminder that I have, and especially the business leaders or others can influence their local leaders, is the importance of national unity and also global solidarity. Through national unity, you will be able to get a united message or a coherent message from leaders. And it's national unity and global solidarity, which is the antidote to COVID pandemics. So thank you so much again, and would be happy with my colleagues here to answer your questions. Thank you.
Thank you very much, Dr. Tedros. And I like the fact that you've led by example in not only keeping to the time, but actually being very brief to say a very packed message, on national unity and global solidarity and other elements that we'll come back to later. As I indicated, we're going to move to Mr. Guy Ryder. I noted that you said my brother to Guy, and then I thought about it. I thought, why am I not your brother when we are both from the same continent? Then I thought, no, you don't mean it like that. It's brother in the UN system, and we are brothers in the continent. So now handing over to Guy. Guy, we are looking to you for guidance as well, because, the ILO and the World Health Organization are the two organizations that are leading in this period of the hard devastation that we are dealing with. The other side of the coin in this emergency situation, where there's a health crisis that has led to a massive economic disruption, is the world of work. It's the world of employment, it's the world of workers who are losing jobs in big numbers. It's the world of business and ensuring that there's business continuity and economic recovery. I've heard you talk about back to normal, a better normal, we would say. Now, in this instance, one has to ask, what would be the new priority towards this objective of a better normal? Is this an opportunity to look at things the way we've done, see how we can do them differently? Is it a possible change to aspects of the global labor policy agenda? Coordinated global action is very key. I've also heard you say, and everybody says that, to handle the global health emergency and the economic crisis. How can the ILO secure coordination with other relevant stakeholders, along with close engagement and cooperation with its very special tripartite format and tripartite constituents? The floor is now yours, Guy. It's over to you.
Well, thank you very much indeed, Matunzi, and thanks to the IOE for this invitation. I'm particularly pleased to be able to intervene after my brother, Dr. Tedros, whose leadership we admire and whose efforts we strongly support. And I think in the light of the very clear message that Dr. Tedros has given us, I don't think I need to reiterate further all of the health policy considerations he has set out as absolutely primordial as we begin to set out and navigate, let's hope, what will be an increasingly generalized return to work in the coming days and weeks. You know, as we think about this process, we are hearing more and more, and it's implied in your question, Matunzi, about the new normal that will prevail post-pandemic. And here I'm talking from a world of work perspective, what the new world of work normal might look like post-pandemic. And I think we have to try to unpack this idea, because whilst it, I think, contains a number of very interesting and important thoughts, I think it contains as well a rather high degree of vagueness and uncertainty. And perhaps my first comment would be that in the light of the events of the last months of this year so far, it would be a very brave person, I think a fairly foolish person, who would make too many precise predictions about what the world of work will look like 1 or 2 years down the road. We do live in moments of very high uncertainty and insecurity. Now, from a world of work perspective, what we have seen is that the pandemic and the absolutely necessary, I want to underline that, measures that have been taken to contain the virus have led to an extraordinary economic and social impact. The figures which you're probably familiar with, which the ILO have put out, the latest figures are that in this second quarter of the year, we estimate that we will have lost, by comparison with the last quarter of 2019, the equivalent of 305 million full-time jobs around the world. That's the aggregate figure, and it's an extraordinary figure. You as leaders of enterprises and employers organizations online, and of course the other colleagues online, will know what that feels like close up when it comes to running a business, when it comes to trying to keep people in work. And the other thing I think that the pandemic has revealed is just how precarious and vulnerable very large segments of the global workforce are. Our figures in respect of informal economy workers show that 1.6 billion informal economy workers are in imminent danger of the destruction of their livelihoods. Their average income has declined by 60% overall. So an enormous impact. The question is, what can we learn what can we do about these situations, and what longer term lessons can we draw from them? Well, when I talk about a new normal, and I prefer to talk about a better normal, I think we should all accept that whatever comes out of this pandemic in the world of work has to be better than a circumstance and conditions in which such large parts of the world of work are subject to the most extreme deprivation and vulnerability. Our colleagues at the World Food Programme talk about the next pandemic being the pandemic of hunger, which is liable to result from the onward path of the pandemic in the developing world. So first thing that needs to be different in the future, I think, needs to be the situation in respect of social protection. It surely is clear to us all now that the gaping holes in the social protection fabric in our world of work is per se unacceptable, and leaves, in the hopefully unlikely event of a new pandemic coming soon, very large sectors of the population extreme risk. This is one area where we can surely all agree that the new normal needs to be a better normal. And what's interesting as well, and we've had many discussions about this in the ILO, is that the gaps in social protection, of course, and we would expect it, are very evident in the area of the informal economy, where 6 out of 10 workers make their living. But it's also very clear in other parts of the global workforce. And so as we have diversified the way work is done, it does seem apparent that many sectors of the new workforce, not just the old one, are left outside the coverage of acceptable levels of social protection. And it becomes evident too when we talk about the measures which we all encourage governments to take to protect and to preserve enterprises and to retain jobs. It's not easy, but it is doable, it is feasible to put in place enterprise support, to put in place job retention measures where you have an employer-employee relationship. The evidence has shown where that relationship does not exist and the status of employers and employees is uncertain, it's been that much more difficult to help people through this crisis. So those are the first points. Second point, when we talk about a new normal, we really do have to make a distinction between those things which we think, because of the impact of the pandemic, will be forced upon us, not chosen by us as preferable or better, but those things which are imposed upon us by the parameters imposed by the pandemic. And there, as Dr. Tedros has reminded us, we're all aware that in the immediate circumstances of return to work, pending the advent of a vaccine, we're all going to have to be careful about social distancing. We're probably still going to be working, so far as is possible, through remote working and teleworking. And here's a point, those are things imposed upon us, they're not chosen by us. And I was very interested by the handout given to me in preparation for this meeting by SHRM, which points out that 71% of employers are struggling to adjust to remote work. I'm one of them, by the way. But at the same time saying one of the things that the virus will change about the world of work in the future is that remote work will become a widely accepted alternative. So that has the feeling from those two statements of a change which is going to come not by choice, but by obligation. Now, I think that we have to be careful not to construct a new normal purely on the basis of what we think is going to be imposed upon us. We need to make the distinction between, I think, the short term, what hopefully is temporary and transitional as we deal with this pandemic and this virus, and then the longer term, where of course policy options and choices are what should guide us in the construction of that new normal. And I'll be quick here. Those of us who took part in, and many of the people online did, the ILO's Future of Work debate of last centenary year, will of course have fresh in their memories the debate about the future of work and the basic proposition that before we even thought about this pandemic or had heard of coronavirus, we were dealing with a world of work which was already entered into, extraordinarily dynamic processes of transition. You know what they are. the ecological transition, the digital transition, the demographic transition. None of these things have gone away. We could argue that the pandemic has complicated them, has added to them, but they remain the key dynamics of the future world of work that we need to design together. And we're all aware that these are capable of and need to be addressed through policy choices. Then my last point, a lot of where we're going in the next year, 2 years or 3 will depend upon the exit trajectory from this dramatic crisis of destruction of jobs and of enterprises. I suppose the first point will be how many lost jobs, lost enterprises will be definitive. What will be the rate of mortality of enterprises and jobs? Jobs simply gone, enterprises destroyed in the process of the pandemic. And what are going to survive? Which are those that are going to still be there when the lockdowns are released and can carry on their operations? So we still really have to come to terms with what the real level of mortality is. We simply don't know yet. And then, and there's so much speculation about this, are we going to be on a V-shaped trajectory, a U-shaped, an L-shaped, a W-shaped trajectory out of this dramatic contraction in the world of work? Jury, of course, is still out on that one. But let's just keep in our minds already some of the key debates that are coming. We do know that practically all economies will come out of this situation with very large and elevated levels of public debt. One estimate I saw was the average level of debt for the most advanced country will be at 120%. What is going to be the public policy reaction to that circumstance? If we cast our minds back to 2008, 9, 10, we know what happened. We know the brakes were put on, we know that austerity set in, and we know that as a consequence, the recovery trajectory was long, uneven, and probably more than needfully painful. We have to have that in our mind as we consider how we deal with the circumstances that will be confronting us on exit from this immediate drama that we're all living through. I'm sorry I've been longer than my brother Tedros and probably said a lot less, but I'll stop there. Thank you.
Thank you, Guy. I think also being brothers, it means you can complement each other and take a little bit from the time he left. So all is good. We're still in very good time. There's no reason for us to be worried. I think thank you for your insights. As well, I took from you something will come back from you said there's a lot of vagueness and uncertainty. Precise distinctions would be foolish, but that a better normal definitely needs to be different and needs to do better for people. And I think on that note, the person who's going to help us now is my colleague from the IOE, Agostina Morni, who's going to give us, I would think, a sum up, which is a very difficult job for her, because I see there's a lot of questions and comments that have been provoked by the two of you, Dr. Tedros and you, Guy. But Agostina is going to give us, I think, about 4 questions at the most, so that we are very prudent with our time. So over to you, Agostina.
Thanks, Matunzi. So Zena Blum, she asked, how long do you expect the virus to continue spreading? Do you feel that enough is being done to contain it? Are we reopening too soon? Christiana Alote asked, experts in Ghana say it has reached its peak. How is the peak determined? Farouk, from our Secretary General from the Bangladesh Employees Federation, asked, how can the WHO help accelerate finding a vaccine? What are the best options for a country like Bangladesh to mitigate casualty and economic disaster? Juan Larcon asked, when do you expect the WHO to issue the guidelines that you mentioned, Dr. Tedros? Hackmeister Dick asked, in an office environment where remote work is possible, is the guidance going to continue to suggest to continue to work remotely as long as possible when shops and other public life has reopened? Biani asked, how can employers deal with the COVID cases in plantations where there's densely populated communities? And Nozifo and Keely asked, how about then for the vulnerable and those and existing social protection systems? How do we deal with that? Thank you. Over to you.
Thank you, Agustina. Okay, that was not 4, and I can understand because they're very different, these questions. Hopefully, between Guy and Dr. Tedros, they will find a way to navigate and get us to have those responses. Whoever wants to be moved first between the two brothers, I'm happy. You just give me an indication. Who wants to go first?
Brother Tedros wants to go first, I suggest.
Okay.
I think it should be Brother Mutunzi who should choose.
Put him in a difficult position now. We are all brothers, by virtue of you being brothers and us being brothers.
Yeah.
So,
by the way, Mutunzi, very
I'll
good.
ask you to go first.
So Mutunzi, I'm very happy actually to see you virtually. I know a lot of many good things about you. We have common friends, so I will let you know when we meet in person, not now, but I'm really proud of you, as always. Thank you.
Thank you so much.
Yeah, so I will start, we will start from here. I have my senior lead of COVID. Many of you have seen her. Mutunzi, you said myself and my colleagues are now very often coming to your homes without permission, so you know us. So one of them is Dr. Maria Van Kerkhove, and she will give us some highlights to the questions raised, and then I will supplement on some of them. Maria.
Thank you very much. Over to you, Maria.
Hi, everyone. Thank you so much for the opportunity to be here and to speak with you. I have to admit, I did not write down all of the questions that came very quickly, so I will try to.
Fast.
It was very, very fast. But I will try to address some of them, and Dr. Tedros will take some of the other ones. With regards to how long will this virus be spreading and how long will this last? I think we get that question quite often. And I think, as one of the speakers already said, it is foolish to predict. What we do know is that in many countries we are seeing a steadying of cases and even a decline in others, and that is a welcome sign. But in a large number of countries we are seeing a rapid increase, and these are in countries across the Americas, in Africa, and still in some countries across Europe. So we have to ensure that we are on alert and we are ready to find cases. And to be able to do so, we need public health systems in place to find the virus. It's incredibly important that even as we lift some of these lockdowns, as we get our economies going, as we get people back to work, and we feel that pressure as well. We have our colleagues who are asking to come back to work as well instead of working from home. We need to ensure that the virus can be found and that you have the systems in place to do so. Another question was, are we opening too soon? The decision to open up economies or lift these drastic public health measures needs to be done in a slow and a controlled way. We cannot emphasize that enough. Lifting all of the measures at once, putting everyone back to work at once, could possibly allow the virus to take off again. And what we have put out some guidance around to take those decisions to opening up the economies. We need to ensure that the transmission in that area is controlled, which means we know where the virus is, we know how to find cases, we know how to care for cases. We need to ensure that there are sufficient health systems and public health capacities that are in place to care, to identify, to test, to treat all cases, to find the contacts and quarantine those contacts. We need to ensure that the workplace measures are put in place. That's what you're talking about here today. How do you ensure that when you do allow people to go back to work, it's done in a safe way? That may, you take a risk-based approach, perhaps putting some colleagues back to work, not at 100%. Some people remain working at home, ensuring that physical distancing is in place and hand hygiene and respiratory etiquette, making sure all of that is in place and that there is a clear plan for each workplace to be able to protect your workers. We need to ensure that the risks of importation from other countries or from within a country are managed. Again, it goes back to making sure that you have the systems in place to find cases. And we cannot emphasize enough the last point is to ensure that all of your communities, your employees are well educated, well informed, well trained. They need to know what this virus is, how to protect themselves, how to protect their families, and how to make sure that they remain safe at the workplace. And as we learn more and more about this virus, they need to be continually updated with the latest information. We're learning something every day. It's very new still, even though I know we all feel like we've been in this for many, many months. It's the 4th month, and we're still learning every day. One last point is that we're learning from some of the studies that are ongoing globally that a large proportion of the population across the world remains susceptible. And that's important because that means that the virus has many places to go. If it is introduced, it means that it can still infect people. So we need to continue to remain on alert. We need to continue to keep people informed so that they can work with you as you give them more guidance, as you update them, that they understand that things may change, and to be patient with you as this information comes out. Lastly, about the guidance we hope will be issued by Friday. And I'm sorry that it's not out already, but we will push to have that out on Friday, and we'll ensure that it's distributed through this group. Gaudens is nodding. You want to the vaccine?
Yeah, I think all the issues are addressed. On vaccines, as you know, we have launched a new initiative on April 24, and the objective was to accelerate development of vaccines, therapeutics, and diagnostics, but not only to accelerate development, to ensure access by all, so that whatever product comes, anyone who needs it have access. And in order to make sure the development is accelerated and access is assured, we need money. And that's why on May 4, there was a pledging conference that was organized by European Union, and we joined as a co-host, and 7.4 billion euro was collected. Of course, that will not be enough for development and then producing enough to reach everybody. So we will have additional pledging conferences to raise more money to meet the 2 objectives that I said. And the good thing about the 2 meetings, the first one, the launching of the initiative on April 24, and then the pledging conference on May 4, the turnout was incredible of the leaders, political leaders. Many countries were involved, and also the agencies, global health agencies that are involved in these areas, the private sector, foundations. It was really amazing. So that's what I said. Solidarity is the answer, to address this pandemic, or to finish this pandemic. And I hope we will have the products as soon as possible. Although it will not be easy, and I hope there will be access by all also to the products that we will have. But the participation of everybody is going to be very, very important, and your involvement, your support in any way possible will be very important. Thank you.
You had one more question. I'm sorry, there was one more question you asked about how is the peak determined, which I didn't answer. Just to let you know, the way that we are monitoring the situation in each country is looking at the numbers of cases that are detected and reported every day. And we plot those on a graph where we see either the case numbers are going up or they're going down. What is important for us to understand when we look at when the peak is to determine when people were actually ill, when people had a symptom onset, which is different than the date of report. So when we look at our epidemic curve, it's related to the surveillance strategy and the testing strategy that is done in every country, the ability to test, the ability to document those cases into an electronic system to be able to graph this. And so we are able to plot and graph how the case numbers are either increasing or decreasing. And that is how we determine whether we are in an exponential growth and whether it's increasing very fast and how fast that is, and also how fast the decline is happening. So that's something that we do at a national level, but it is important within each country that you do that based on the lowest administrative level as you can, because this virus behaves differently. It's not uniform across the country. And this is an important consideration when you're thinking about putting people back to work. You may need to think about a geographic approach. If the incidence, or if the transmission is different in different parts of the country, you may be able to open up sooner in some parts of the country where it's not as intense versus other. So it does need to be evidence-based, data-based decision-making. We'll have to take over.
Thank you very much, Maria, Dr. Tedros, Guy. Any questions you want to take or answer, respond to?
Well, Matunzi, I think the questions were really directed at the colleagues from the WHO and have been extremely well answered by them. Can I just underline what I think some of the messages that I take from the questions and the responses? Our WHO colleagues have emphasised, and I've noted down the words, that the return to work needs to be slow, controlled, deliberate, progressive. I mean, this is the mantra which I think we all need to heed in a very serious way. We hear governments, don't we, all over the world saying that they will be guided in the public policy decisions that will frame our returns to work. No, they're being guided, they're following the science. Which I suppose is what should happen. We have to observe, I think, that the science is leading them in different directions and to draw different conclusions at certain times. But this is the framework within which we, as the actors in the world of work, must operate. Our role, of course, is to bring in the element of social dialogue, the close cooperation of governments, employers and workers in the process of return. And just to say, I mean, here at the ILO, we started on this process in our building, which normally contains in excess of 1,000 people. To observe social distancing and all the protocols that we're being taught, which are being told about, the maximum capacity of this building in a period when we still have to observe social distancing and the other disciplines, we reckon is no more than 400 people. So that gives you, I think, some sort of impression from only one example of quite how different the processes that we're going to have to observe really are. It also means, and I'll finish with this, that remote working and teleworking is going to have to be a part of our lives for the foreseeable future, a significant part. It's important that we also learn from the experience of teleworking and make sure that we have in place the right policies, the right practices that make teleworking a satisfactory option for those involved. A technical note we're putting out this week at the ILO estimates that whilst in some countries, the most advanced and most propitious countries, some 35% of jobs or at least of tasks are susceptible to teleworking, but the global average is 18%. I'll leave it at that.
Thank you very much, Guy. I think it's very important. I'm happy that you also stressed the importance of social dialogue, the importance of tripartism, which of course is what the ILO is known for as the only such agency within the UN family. So colleagues, thank you, Maria. I think I need to repeat something that Maria said, that in addition to a slow and controlled way in which we need to do this, we are also learning every day. I think she said we're learning on the job. This is learning on the job, except we have to move as quickly as possible, and people are looking for our guidance and leadership. And so we are seeing an amazing level of collaboration between the private and public environments, and never has it ever been more necessary. Now, Dr. Tedros and Guy, should you at any stage feel you need to go, you are released. And I do look forward, Dr. Tedros, to that conversation about that involves our common friends. I think I have an idea who our common friends are, but I'll also leave it for later. Now, in the interest of time, colleagues, we have just over an hour. We now move to our next panelists. I want you to also know we have over 240 people who are here. There are people who are also listening on a live stream on Facebook. So that's how well attended this session is. The next panelist to address us, as I said this morning, woke up much earlier than some of us to be here. The time now in his town, I think is what, in his 8 or 9. I haven't looked at the time, but he had to wake up very early to be with us. Johnny C. Taylor Jr., who is the president and CEO of SHRM. Now, the questions for you, Johnny, that will help in just shaping your keynote with us is, what are the key factors to consider when setting up a return to work plan? How can HR service industries leverage employers, organizations, networks, and services? What are the key challenges and factors to consider when setting up a return to work plan? The IOE and SHRM have launched today a guide on return to work. Can you say a few words about this guide? I would like to hand over to you, Johnny. You also have your 10 minutes. We're eager to hear.
Thank you so much, Brother Matunzi. I'm yet a brother on the other side of the world, but thank you for having me this morning, and thank you to all of my colleagues. Errol, good morning. Director-General Ryder, good morning to everyone who's joined us. And Dr. Tedros, of course, yes, you've been forced into my home every morning and every evening. Good morning. Bring you greetings from Washington, D.C. I'm here at the United States U.S. Capitol, and we really, as you might imagine, are knee-deep in this. SHRM is the world's largest HR organization. We have 300,000 members across the globe and 165 countries. My comments today will be specifically from their U.S. findings, so they will be U.S.-centric data. But it's important to point out, though, that we're taking and receiving information from all of our members across the globe, and thus ultimately we'll be producing global results coming out of and emanating from those 165 countries where we have members. I think it's really important. I heard a phrase used earlier, which was, we're trying to balance, if you will, lives and livelihoods. And that's where this is really a critical issue for all of us in this space. While the medical community is rightly very, very focused on how to eradicate, or at a minimum, largely reduce the impact of COVID, our biggest challenge that a lot of employees are saying and responding to are how this is affecting their livelihood. The reference to the next pandemic will be that of hunger or starvation is a reality for us. And so we are trying to balance, get in sync those two issues. Before I quickly get into my comments, the U.S. War College, the U.S. Army's War College, right after the close of the Cold War in the early 90s, came up with this concept called VUCA. It's an acronym that stands for volatility, uncertainty, complexity, and ambiguity. And it helps leaders navigate through these periods. So VUCA is really, could not be a better concept for us to take into consideration as we try to navigate this new normal. For that reason, we are excited to launch together today the joint report from the IOE and SHRM, a guide to bringing people back to work responsibly, safely, and frankly, as quickly as we can, because of this requirement that people survive and eat and have a decent, high quality livelihood. We brought together a checklist that we're bringing to the global community. So while we are in the US, it's a global product, because everyone needs answers about how to manage and navigate during this dynamic situation. Most importantly, this report is data-driven. This is not based upon sort of what we think, or at least what we know at the moment. It is data-driven. Our in-house research and HR knowledge teams have been gathering data so that we can pull this together very quickly and partner with the IOE and come up with something that is useful as we all think about how to bring our employees back to work. More than anything, employers need up-to-the-minute intelligence. Just as we have on the medical side, we need this in the workplace so that we don't create, make a worse situation worse. And so that's what this is all about. I'm really excited about it. We'll be releasing it globally today, along with IOE, and I'm pleased about that. I want to quickly get into a couple of slides. I'm going to be very sensitive to the time limitations that we have. We've done some research. As I mentioned, SHRM has a large staff of PhDs and researchers. And one of the things that we've done is really observed what are the top challenges for employers. There are two that I really want to bring to your attention. One is that 71% of employers, Guy mentioned this, are struggling to adjust to remote work. This is far more difficult than in the beginning. We understood all along that remote work was offered as an accommodation or a perk, but now this is mandatory remote work, and I'm telling you, employees are struggling with it and employers are struggling with it as a result. So that's a significant number of nearly 3/4 of employers are struggling. 65% say that they're really struggling to maintain employee morale. People are stressed. Even the stressors that result from working remotely, isolation. We're seeing in the United States in particular, very high rates of suicide. We're seeing significant depression. All of that emanating from this work from home reality, and more importantly, the forced work from home reality. And so we're trying to navigate that. Quickly, three things that we're seeing. More than a third of US employers are facing difficulties with company culture, not surprisingly. Employee productivity, not surprisingly. We make the assumption that you'll be more productive because you're working from home and you don't lose that hour, in some cases 2 hours, of getting ready and getting to and from work every day. But the reality is a significant number of employees are reporting, and employers are reporting, that the productivity that they thought would come from remote work is not necessarily panning out. And finally, leave regulations. Across the globe, the United States has not been a leader in this area, especially when we speak of paid leave, but this has forced us, as we think about how we're going to move forward, to readdress leave regulations. I want to talk about the impact of this on business practices, moving to my next slide, because this is, again, we're balancing lives and livelihoods. The coronavirus has prompted 40% of US employers to shut down certain aspects of their business. And these are permanent in many instances. Some 83% of employers have had to adjust their business practices quickly. Half are no longer hiring, period. And it's ironic and almost surreal to think that 4 months ago, we had 3.5% unemployment. And now we have 30 million people who filed in the US for unemployment benefits. So we're not seeing the hiring that we used to have. And it is a horrible time for recent college graduates who are coming into the workplace. Many of them thought they had done all of the right things and had earned their degrees, and many of them had offers that are now being rescinded. 31% of employers have laid their workers off. 15% have cut headcount, more importantly, with no intent to rehire. That is a very big stressor for employees because they hear that. They know that this is their reality. A significant number, over 50%, have either decreased employees' hours and or reduced the pay. 14%, as you can see from our research, have hired more employees, but it's critical to say those are in specific industries. Retail, for example, our Walmart here in the US, 150,000 employees they announced hiring. So certain industries are hiring, but by and large, most employers are going the opposite way. And finally, as I alluded to earlier, the paid leave. That is a very important consideration now in the United States. Many employers voluntarily offered it, but now we are visiting whether or not the federal government is going to pass legislation to require it going forward. I want to talk to you about quickly before we close, and because I want to give some of this time back, is how things are going to change going forward as best we know. Taking the point that all of us are guessing, it's just what we think we know about what the world will look like, what the new normal will look like. If I can go to my next slide, there's some realities though that we have come to know as a result. Remote work, as we said, it will become a widely accepted alternative. And again, in the past, it's been a perk or an accommodation that an employee would request. What we're seeing is there's a significant trend toward employers saying, no, we're going to mandate it. To that point, we have some hot off the press data that says while 64% of salaried workers in the United States are working remotely, employers believe that that number will reduce to only 5% over the next 6 months. Again, critical issue for us to help employers do this responsibly. Finding talent will become easier. There is what was a seller's market from a talent perspective is now a buyer's market because there are so many employees in the market without jobs. It's going to be easier and it's going to be done more globally because in the past, we thought certain positions had to be physically located near us. And what we now know is that because of remote work, because of technology, jobs that we thought in the past could not be done remotely can. So I think in some ways, we're going to open the aperture and allow employees across the globe to have opportunities that were very localized. Virtual learning, don't have to tell you, we're all Zoomed out or WebExed out or Skyped out, but people now are understanding the importance and the accessibility of virtual learning and the need for lifelong learning. One of the questions I noted was, I saw that someone sent in, is this an opportunity for us to reskill as we think about bringing all people back into the workplace? Telemedicine. That is an area that we're seeing a significant uptick in. In the past, if you were sick, you wanted to go in to see a doctor. Well, doctors, healthcare professionals are now encouraging people not to come to the hospital because they may leave with something they didn't come with. And so we're actually seeing people embrace the concept of telemedicine. Virtual reality is what we're all experiencing right now. We're meeting across the globe. Many of us would have jumped on a plane for this 2-hour meeting, and now we're able to do it right now from our offices. And then finally, and we should have expected this, employers across the globe, but especially in the United States, are expecting that they will be fiscally conservative. This next decade will be one of austerity. Even for the organizations that have resources and are cash rich, they're going to revisit how they spend their money. Finally, I want to wrap this up. Again, I have a lot more to talk to you about, but we have some really interesting findings that have to do with how the world will shift going forward. Last slide. And it's key considerations going forward. The challenges ahead are varied, of course. Potential long-term economic hardship and the ability to find capital are real. The newest clause, and what we've now seen a lot of in the HR world, is business continuity. In the past, we all thought that business continuity was more about hurricanes and our part of the world, cyclones, other parts of the world, earthquakes, et cetera. And now infectious disease policy is something that we've got to revisit when we look at the risks that our organizations are exposed to. Organizations, and specifically HR, will need to be stewards of health. Mental health as well as physical health, critical point, continuity and wellness. And then finally, 15% of organizations have already stated that they're going to permanently implement new realities of their operations in the future. So while we don't know necessarily what that will be, we suspect that people, for example, won't be shaking hands. I heard a guy say that his facility that would otherwise hold 1,000 people now will safely hold some 400 people. The world is going to change. But I want to thank everyone for giving us an opportunity to partner with the IOE with these new guidelines. Thank you.
Thank you very much, Johnny. The better normal, the world is going to change. But you know, one thing that was very good to take out, in fact, two, you spoke about finding talent will be easier. You know, we do need some good something to come out of this, because everybody talks about all the negatives. So I'm happy that we also have to lift people up, because as much as the crisis is hitting us hard on every front, but I think mentally we also need to be strong and ready to pick up the pieces at the end of the day. But I just wanted to tell you something a little bit funny, Johnny, and I don't know if you know this. So when you are talking about VUCA and you were giving all the meanings on volatility and whatever you, in my language, in fact, a few of the languages we speak in our dialects in Africa, VUCA means wake up.
Oh, wow. That's
when I say VUCA, it's an imperative that says wake up right now, no other. So maybe this is a wake-up call. And I think on that note, we now move over to Jacques van den Broek, the CEO of Randstad. Very easy surname, Jacques, because, you know, as you know, South Africa, we have Afrikaans here. So when I see van den Broek, I get very excited. Shall we rethink the way we work for a better and safer future? How can the HR services industry help? What is the new normal in the workplace? Will the new normal, or the better normal, as Guy was calling it, include more flexible and extended teleworking policies? Johnny says yes. Teleworking policies are now going to be with us. A lot of everything is going to be happening. So the floor is now yours, Jacques, for the next 10 minutes. Thank you very much. Unmute yourself, Jacques. Unmute.
Let's first get safely back to work, and then we'll see how it all pans out. So we have created an alliance with the top 3 of the world staffing organizations, and we launched an initiative on the 16th of April to see what we can contribute to get people back to the workplace. We've made some slides, so maybe the next one. We've already talked a lot about what's mentioned here, but what we've created in this alliance is a pledge, first going out to governments, employers, trade unions to say, okay, how can we get in this country things back to work? When I talk to governments, of course, they now, and we talked about it once, the infections go down a bit. You want to, while the virus is still among us, you want to get back to work. But how do you do that? And how can you do that effectively, efficiently, not reinventing the wheel in every country? On the next slide. So what do we bring to the table? We are, in a way, the world's largest employer as a sector, bringing 58 million people to jobs every year. But more importantly, we are sort of a last mile sector. For years now, we work with our clients on health and safety protocols in chemical plants, in food plants, in life sciences. And of course, during this crisis, production in many sectors went on. And how did they do that? Well, we think it's crucial, and we have that in-depth knowledge to analyze safe working environments. In most of our businesses, we have health and safety departments that advise our clients on how to do this. And that is what we see is really the struggle of governments, of trade unions. How do we make sure that once we open up an economy or a sector, that it's being implemented in the right way? And we also already see, after launching this initiative, that a lot of companies, our clients, have these questions also. How do I... And what is the protocol? Is the protocol practical? Is it detailed enough? How can I work with that? And next one. So health and safety protocols, they need to be updated. They're updated all the time. And of course, this is by far the most, call it comprehensive return. But if you look at a safety protocol, it's actually an 80-20 thing. So regardless of different sectors, 80% of a safety protocol is the same. And that's what we bring to the table. So we compare other industries. So for example, a Spanish industrial bakery created an environment where people can work safely, not being more than 6 feet apart, because that's not possible in that sort of situation. And we bring that to other industries in other countries. We do think, but it goes for a lot of, I think, problems of our time, that we need to have public-private partnership. If you don't start doing this with governments, employers, trade unions, and companies like us, you will not get it off the ground. You will be stuck. For example, we see differences per country. So in a country like France, there are more people currently at home because situations, trade unions feel themselves less involved, and they've said, well, this is an unsafe workplace. So we need to have collective ownership, collective responsibility for bringing people back. Next one. So what can we do? We've collected a knowledge base of what works well. When you talk about protective measures, when you talk about public transport, when you talk about government responses, when you talk about the role of trade unions, the illness trajectories that we talked about earlier, protective gearings, we bring that all to countries and then to companies on how to use these best practices. And we do see cultural differences. In Asia, it is much easier to, in a way, override privacy almost with tracking and tracing, where Europe and US are still struggling with that. Again, yeah, that's what we bring to the table. And we've created a global grid, meaning that you don't need to reinvent the wheel on a protocol. It's all there. Yeah. And next one. So what are we focusing on? We recognize 3 phases here. Most countries are in phase 1. Phase 1 is where we create this alliance between relevant stakeholders. Governments, they are always in charge. They need to open up the economy. Employers and trade unions. So very much the people who are listening to this conference. Then in phase 1 you say, okay, let's go. Phase 2 is really about implementation. Implementation at the lowest level. Implementation at every company, small, mid-size, large, in every country. The third one is going to be later, and that is what Guy also talked about the inclusiveness of a workplace. Which people have come back to the workplace and how quick did they get back to the workplace? If they were in a fixed job, if they were a freelancer, if they were a gig worker, if they're working through the likes of us, have they been retrained because their sector has shrunk a lot? We already see that. We don't expect airlines and that sort of industries to bounce back really quickly. So we're training people because there is still a lot of demand, even in these challenging times. So we're focusing, as mentioned here, on what we wanted to start out with 10 countries, but we're already in 15 countries and in 5 major sectors. And what we're seeing now is there's a lot of demand from governments, from NGOs, from employers' organizations to get rolling. So on that note, the last one. Okay, so this is the Netherlands. In view of the time, I'll just skip this one, but it is a best practice on inclusive working together to open up the economy. But the last one, I think very practical. Next slide, please. Yeah, is how to get in touch. There's actually 3 angles. If you want to join the alliance, if you are an HR provider, from a public affairs point of view. From a public affairs point of view, we also reached out internationally, and we're very proud of the agreement we made with Uni Europa, the trade unions body European, on creating a partnership on this get back to work, where Uni Europa really also adopted our proposal. So I think that's a great way to go about this. So on that note, back to you, Tunzi. You're on mute.
Yeah. Thank you. I pressed the button.
The best of
Thank you. I pressed the button that I was too eager to start going. Thank you so much. Thank you, Jacques. The takeaways as well, and Agustina will be back to do what she did earlier on and get a few questions for all the panelists. But I did hear you talking about PPPs being very key, collaboration being key, and the global grid that you've created as part of the protocol. I think that's very important. We're talking guides. We've got a guide by the World Health Organization. We've got a guide by SHRM and IOE. We've got this global grid and protocol. So we've got tools that we can use. And I think that's the positive side of this discussion. We're now going to our sister, to make sure that sisters can share with us. And my sister here is Sharan. We have a very good working relationship with ITUC. We work closely with ITUC, ITUC being the representative of all the workers that we work with in the social dialogue that we do in the ILO. And as the General Secretary, Sharan will be talking to us about social dialogue being key in finding solutions to tackle the emergency. And I think in terms of some of the key highlights or areas that I would like to point out or questions, Sharan, is can you mention some examples of agreed solutions to handle the back to work phase? We've always talked about the importance of the transition to the formal economy. It has become more evident that the informal sector is the most affected by the crisis. Now, as we have seen from the crisis in the post-lockdown phase, as we try and recover, what innovative ideas would you say we need in being solution-oriented? What role should the unions play? What should be done to raise better protection for all workers? In your view, how can employers and workers work together to ensure a safe and effective return to work processes? Sharan, you've got your 10 minutes. Over to you. Thank you very much for being here.
Thank you very much, Mthunzi, and nice to see you after an absence of our discussions at the ILO level. So I wanted to thank Dr. Tedros publicly as well, because I think we want to reassure him that we understand we're living through a global period of, solidarity that's the greatest in our living history. And that's about putting lives first. And so we thank him for his efforts, and we accept his wise counsel on some of those questions. I also thank him personally and his team for revising with some requests from many workers who are expert in occupational health and safety, the actual return to work guidelines. But I want to start, Mthunzi, where Jacques left off, because I think the workplace is the place we need to start, and then say what's the scaffolding or framework globally, nationally and globally beyond that. So I think we all accept that the workplace safety is a priority. If we're to avoid reinfection, if we're to be resilient against further crises, then we must make sure that our workplaces are safe. There are some practical elements, of course. There's PPE, there's social distancing, there's, practices that mean that human contact is eliminated. And there's, of course, the best antidote, which is washing your hands regularly. We know there are many workplaces, areas of work, Mthunzi, particularly in your continent, where running water is still a challenge. But where we have the luxury of running water and health products like sanitizers, and we also need to make sure work is designed to allow those breaks. We believe that workplace assessments with unions, where we can see they're being effective, people have trust to go back to work, and reopening is going to be trust is going to be a huge element. So, where we are seeing countries work with the trade unions and employers, or even just bilateral arrangements for return to work, they're the most successful. Of course, part of that is also the reality that with the job loss projections that the ILO has put out and we concur with, then, up to 300 million jobs or part-time or equivalent full-time hours is a devastating loss. And so in some of our countries, it will be possible to actually share work for a transition period. So maximizing work while you're sharing part-time work, maximizing wages with government support as well as employers while you're sharing hours of work. The best agreements between the unions, employers and the government are in Austria, with 80% of wages guaranteed with some government support for business continuity. That means jobs and wages. And of course, in Germany, where this emerged as a resilience measure with great success in the transition after the 2008-2009 crisis. And it's not lost on any of you who run businesses or service businesses that we could be facing a situation that's much greater than the impact of the Great Depression in the 30s. So that also tells us we have to look to what were the measures and where can we increase measures and provide new measures that support this. Well, jobs. We have to look at where we bring back employment. That means bringing back businesses. Our greatest fear is that many businesses will simply not open after 3, 4, 5, 6 months of inactivity. We've actually been shocked to see that even the major business houses often don't have 3 months of operating reserves. You may recall in 2008, 2009, that became a part of a regulatory environment, and we have to look to that because resilience, recovery, yes, but also resilience, so we have the means to manage further crisis. So investment in jobs, we've all agreed, infrastructure, absolutely important. The care economy, critical to involve women, and good jobs in the recovery. And of course, there will be very many new areas that will test us to discuss the best and worst of technology. The best can help us, but the threats of the worst of technology are also something we can't avoid. And of course, telework. Everybody's mentioned telework. Well, I have to tell you, I'm in Guy's camp. I'm not someone who is content to stay at home and work for very much longer, although of course we will accept the discipline that is necessary. But there will be more and more telework. The question is, are we equipped, Matunzi? And it's up to the IOE and the ITUC in our global standards approach to do something about the standards that make this possible, both for employers to manage and workers, taking into account the advice of the WHO and others about mental health, about connectivity, and about safety. And so we have to look to the future around something that we hope that you will join us in, which is a new biological hazard standard. If we want to protect the world in the future, we must look at what it is that constitutes a workplace threat of disease transmission. And of course, we would also hope that we settle the fact that above all that occupational health and safety becomes one of the fundamental rights, so we can work on this through social dialogue together. But investment, it must be an investment-driven recovery. That's all about jobs, jobs and jobs. But it also has to be underpinned by your point, Matunzi, which is extraordinarily valid, that we've seen the vulnerability of 60% of the workplace, not all in poor countries, but in the informal economy where the most of those workers are. But it's also platform businesses, freelancers, the musicians and artists of the world, all of the people who suddenly found themselves without an acknowledgement that they are actually essential in contributing work to the health and the economic base of our economies. So we do have to look to say what's the resilience going forward. For us, it is the ILO Declaration. It's the Jobs Compact, which we negotiated through, so not the Jobs Compact, the Labour Protection Floor of the ILO Declaration on Human Rights. Mind you, the Jobs Compact negotiated in 2010 wasn't all bad. But this actually has a labour protection floor, which does guarantee rights and occupational health and safety, but it also guarantees a minimum living wage and maximum hours of work in relevance to whatever the workplace environment is. It puts a floor under all workers, irrespective of their designation of employment contract. And at the same time, it must be married with universal social protection. And one of our biggest challenges now, because it can't be lost on you, because I know many of your employer colleagues, particularly in Africa, parts of Asia and Latin America, are actually helping with unions and government actually deliver food packages, because we have up to 250 million of our brothers and sisters who are in fact facing starvation. Many of them indeed individual entrepreneurs. And then, of course, we must also look to the fact that without social protection, we will see some 500 million people slip back into poverty. That's not good for economies, not good for social peace, but it's also not good for the basic area of security that we need to provide in regard to resilience. So universal social protection. And if I ask employers to join us, because Roberto and I have been very strong about this, we're both committed to social protection. Guy said it, And right now it would take for the poorest 28% of poorest 28 countries just 37 billion for 5 years to establish and build social protection systems, particularly health and indeed income. If you had 100 billion, you could part fund indeed those lower to middle income countries and again build basic economy and resilience. That's a drop in the ocean to the 10 trillion that's projected to be spent in this crisis phase alone, and with recovery plans that will make the Marshall Plan look like a cake run, then we know that that's again a pittance by comparison with what the world will spend to get us back into some new economic and social reality. And it can't be just as simple as a new normal. It's what Guy said. It must be different. We must look to what we want to build that is genuinely about an inclusive social and economic future. Then we'll get the trust. So I do think the IOE, the ITUC and the governments in social dialogue, but at the national level as well as at the global level, can help us come out of this. And I just want to finish by saying thank you to the IOE for the work we've done, not just around these questions and the question of debt relief, but also the work we've done jointly to expose the collapsing non-essential supply chains, and in particular that of the textile sector. It's a bit of a model for other sectors, but if we want to have an inclusive future, then we have to work together to see that business continuity means jobs, wages, and that we're all in favour of funding universal social protection. So safety first, now as we reopen, but let's get the global framework that drives national policies and vice versa to make sure that we have a resilience in recovery, that we're building resilience through recovery to deal with future crises. Thank you.
Thank you so much, Sharan. As I said, we work very closely with Sharan. We work very closely with ITUC. And as she pointed out, we've already done quite a few things over the last few weeks. So that's why I joked at the beginning of the session that back to work for some of us is a bit of a funny, because we never left work. Actually, we've been a lot busier than we've ever been, discovering that back-to-back video calls, and now having to choose which technology poison you like the most, whether it's Zoom or WebEx or WhatsApp or Facebook or Instagram, but at all times we've been working. So I think on that note, and having talked about an inclusive social economic future, that's very, very critical as well, and the issues on informality. I'm now going to hand over to Agostina to give us the questions that I can get to all our colleagues. So Jacques, Sharan, Johnny, are you still here? Is Johnny still here? Okay, he's here. You just switched off your video. So Johnny, Dr. Tedros had to leave. I think Guy also had to leave. But we've still got 220 people that are connected with us, and about 69 on Facebook. So we've got quite a lot of people waiting for the responses. Over to you, Agostina.
Thank you, Mutunzi. There's a question from David Wilson from Ghana. He asked, what does it mean for the future structure of employment contracts and collective bargaining agreements that do not have force majeure provisions? Dr. Ivan asked, how can HR and OSH practitioners work better together in practical terms in a safe return to work? Third question, have you seen any court cases involving layoffs or dismissals with regards to COVID-19? What are the precautionary measures that can help protect employers from these legal cases? And one last question from Shay, our representative in New York. She asked, will employers invest in reskilling with the limited resources that are now available? Thank you, Mutunzi.
Thank you very much, Agostina. Who feels moved to go first?
Mutunzi, it's Johnny Taylor. If I may,
Johnny, go for it, Johnny.
Thank you. In particular, the question, I have comments about all of them, but I'll focus on one as my colleagues, I'm sure, can address them all as well. But the one about lawsuits, it's interesting from, as a former lawyer myself, one of the things that we're beginning to see, and we anticipated it, was as we think about bringing people back into work, because the guidelines have specifically said people over 60 are at risk and people who have certain pre-existing health conditions are at risk, employers are now making decisions for employees about who can come back to work and who can't. So literally we're seeing people say, well, you have this particular health condition and therefore you're not safe enough or well enough to come back to work. And that's going to expose employers to significant, at least in the United States, litigation, because there's one thing to accommodate a disability, there's another thing to make decisions for a person who has a health condition or disability. And it's especially bad when you think about ageism. The risk that you run to say, well, everyone over 60 has to stay home and only the younger employees can come back into the workplace. So employers need to be particularly careful about how they decide who's going to come back. In the instance, for example, of SHRM here in the United States, we are literally going through, we're looking at who's going to come back and who will work remotely going forward. And then we're doing an adverse impact analysis to ensure that we are not unintentionally discriminating against one group more than another based upon well-intentioned, our mind thinking we're not trying to hurt older workers, but if we are being too paternalistic in our approach, we think there'll be significant risk to litigation. So that's one area that I think we all should pay attention to.
Maybe I can share some light on the reskilling thing. The interesting thing is, on the one hand, you see a lot of people who lose their jobs. At the same time, there's also demand already now, but certainly there will be sectors which will be more in demand than they are today. So I think it's very much in the interest of employers, but also in the interest of employees. And as a sector and as an HR sector, we can definitely help because we know which sectors will be at work, to invest into the reskilling of people, either to keep them in the workplace or have them get back to the workplace. We've also seen unprecedented government support in this crisis, which compared to 2009 is way better. We can also use that for reskilling because a lot of that money at the moment is to still pay people when they're at home. I think we should, in the coming weeks, months, move that to investing in people, to getting them back to the workplace in the job they had or in a job which is new for them.
Thank you, Jacques. Sharan, anything you need to add?
Well, I think the wise words from Johnny on litigation, from workplace litigation to some government litigation too, because we've seen some great advances in measures around social protection and support for business. But we've also seen exclusions in many countries, some of them just thoughtless on the policy front, some of them not captured by the the definitions of employee or the nature of business registration. So we do need to actually say what's the support going forward. I think we will have to, I don't disagree with Jacques at all, but I think we will have to focus on who do we have to support at what equivalent to minimum wages for some time to come, or at least a negotiated percentage of agreed collective bargaining arrangements for some time until the jobs are able to be guaranteed. But I also agreed it is a good time for reskilling, and I've been interested to watch the development of the agency policy framework, because they are in fact increasingly a secure jobs provider with permanent employment and good union agreements in many areas, but also they are in fact a job resource of last resort. So I think we'll have to look at what's the balance for all of that, but people's lives and livelihoods are the only thing that will build trust. So if we don't have a job for them where we can make sure they have minimum living wages, safe workplaces, and a right, of course, to bargain collectively with social dialogue, then we need to say, how do we support people at home to see that there's not the social, we don't continue the age of social anger that was already a result of inequality. And I'll just finish by saying we must remember as we reset the button on our world that we already had a convergence of crisis. We had inequality that was an economic as well as a social risk. We have the climate emergency, it's not going away. It's about the extinction, the risk of extinction of the human race. We have an equality crisis for women because progress is stalled on every indicator. And it's an irony for us to see that the frontline workers, 60% of health workers are women, 56% of service workers, and they're amongst the lowest paid in the world. And of course, we have now the recovery challenges from COVID-19. So we have to put that together in an integrated frame. And it's only through the social dialogue with business, with workers, with governments, and where necessary, of course, with civil society, that we will rebuild our communities. But in the first instance, it will find the mechanisms to provide them with the capacity for survival.
Thank you, Sharan. I think, Johnny, do you want to say something? You look like you wanted to say something.
No,
Okay.
I'm good.
I just saw green on your thing there. But colleagues, I really have to thank you. You know, it's amazing that when we started with about 212 people. It grew to about 232, 233, and it stayed at about 190 now, because, you know, people obviously have to go and attend to other matters. But we have 69 people that are on Facebook. So we had 300 people that were listening, very active questions that were coming through. I do just want to mention very quickly that, and I typed this on the chat section as well, that the IOE team will be fielding all the questions that you feel we did not cover. If you feel there's something we did not cover, the IOE will be able to respond to it. Of course, go onto our website as well. I have to say, secondly, we are now officially launching the SHRM IOE guide for back to work policies. It's officially launched. Go to the SHRM website, go to the IOE website. You shall find that we have the document and the guide there. You did hear that we're also getting a guide from the World Health Organization on Friday. Maria and Dr. Tedros mentioned that we'll get a guide from them on Friday. You did hear from Jacques that we've got the protocols that they've put together. They've got the grid, the global grid that they've put together. You do need to have access to that, and we thank Randstad, of course, for that and participating. We continue doing a lot of good work with Sharan. We have to talk about social dialogue. For us, social dialogue is everything. For us, tripartism is everything. We cannot allow the world to forget that without social dialogue, without the necessary participation of all the partners in the world of work, we are not going to be able to resolve the challenges we have. The issue of informality, the issues of social protection, we do need to come up with some innovative ways. I mean, I did mention, Sharan, that for many years, I don't know, and I'm leaving this as something we must all think about. I've never been quite convinced about all of us, including me, saying we must transition informality to formality. I don't understand that. I've never understood it, but I thought, you know what? I should listen to my more wise friends, and I bought into it. But actually, now I realize I don't think so. I think, firstly, it's a very inadvertently patronizing concept, because we assume that people in informality want to go to formality. We've assumed this. And whilst our intentions might be noble, and our intentions are great, because what do we want to do really? We want to bring everybody into the social protection net. We want to bring everybody into the social security net. We want everybody to contribute to taxes. We want everybody to be part of building societies and economies. Okay, that's what we want to deal with. But I'm not quite sure, as in law would say, it's a non sequitur. It doesn't follow. It doesn't follow that because you want to do that, the way to do it is to transition people who may be very happy with informality, who may be very happy running businesses the way they are. In fact, what we are seeing is people in the formal sector transitioning to the informal sector. Why is that? So we need to find what the solutions we are looking for without necessarily prescribing what it should be, because we all agree on why it must be done. And I think when Jacques talks about PPPs, that's absolutely key. We've paid a lot of lip service to PPPs, all of us. We, on the rhetoric level, PPPs all the way. But when you have to actually do it at home, at national level, somehow they never happen. Somehow, maybe it's this trust that Sharan is talking about. We need more trust in the system. We need to trust each other. We need to believe in each other that we all want the same things. We all need to believe that we want very healthy, thriving businesses. We want thriving businesses to have thriving people who thrive because of good jobs, who thrive because of a sense of dignity, who thrive because of decent work, who thrive because SDG 1 and SDG 2 on poverty and hunger are being dealt with via SDG 8 on decent work and economic activity. We need to be alive to these realities and deal with them in this way. Now, Guy also talked about issues of a V or a U or a W trajectory. Well, we don't know what it's going to be. We have no clue what it's going to be. But here's what we do know. We do know that the last financial crisis did not go very well in its recovery. We do know that some countries never recovered from that financial crisis. We do know that in the middle of everything we do, we should be having productivity. We should be creating full and productive employment. But do we do that? I don't know. We do talk a good talk, but implementation, enablement on the ground, our government partners are not doing that. They're not paying attention to the productivity institutes they have. They're not paying attention to the collaboration that is necessary to ensure that all the agencies that are supposed to create work, that are supposed to do what it's supposed to do, work together in unison. I think similarly to the points that were raised by Dr. Tedros, when he talked about national unity is key and global solidarity is key, and the coherent messages that he says will be an antidote to all the problems that we have. I think, colleagues, on that note, with all the wisdom we've had, Johnny also talked a lot about collaboration. That wisdom is something we need to take away and work on tools and actions of ensuring that we have businesses that get back to where they were, if not better, so that we can create jobs, retain jobs. And I think on that note, I do want to also thank my team. It's very important because, we always forget, we all look very good. Moderating, I look excellent. Everybody thinks, Mthunzi's got this. Actually, I've got 4 phones here and an iPad and this laptop. And at any given time, I've got to look at all the messages I'm getting and from Twitter and whatever you. And I want to thank my president, Errol, who's always there, even when he doesn't have to. Even when I want to give him a break, he wants to be there. So we want to thank Errol, thank Roberto, who's ably assisted by Matthias as the Secretary General and the Deputy Secretary General, and our entire team, Agustina, Lewis. Once you start mentioning names, you might forget other people and get into trouble, but I've already done it. Maria and everybody else we've left at home. Thank you, colleagues. We really appreciate this. We've finished with 15 minutes to spare. That is what you call productivity. That's how we do things in the IOE. We finish early so people can go and do work and make things happen rather than just talk. So thank you very much, colleagues, and goodbye.
Goodbye. Thank you.